Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast where we teach compassionate communication, provide perspective, and inspire resilience. I am really excited today to bring to you Dr. Stephen Goldberg. Dr. Goldberg, thank you so much for joining me on the podcast. It's good to talk to you.
Great to be with you, Marcus.
Thank you. Thank you. And I looked over your bio and information this morning. There's a lot of things I want to cover, but I'm wondering, could we just start out? Could you just give me a little bit of an idea of your professional bio, and then it'll give me a few jumping off points for questions that I have for you.
You bet. Well, I serve as the Chief Medical Officer of HealthTrackRx. We're an infectious disease testing laboratory. Our headquarters are in Dallas, but our anchor lab is in Louisville, Kentucky. And we provide next morning results to urgent care clinicians, pediatricians, women's health experts, family medicine doctors. So when someone comes in and says, I feel ill, and they think it's an infection, they use one of our tests, they put it in the box outside their door, and it's flown to Louisville through UPS, and our team works at night and provides a result the next day. So our testing helps clinicians be more selective, for example, with antibiotics. That's my full-time role. Part-time, I work as a clinician at U of L Health in both primary care and urgent care. And then my background before that is I served as Chief Health Officer for Quest Diagnostics. And before that, I had an 18-year career in the health plan space, serving as a Chief Medical Officer for a publicly traded health plan.
You've had a lot of varied roles, and I don't know if we ever said this. I know you said you're a clinician and medical, but we should state that you are an MD and an MBA as well. So you've got a lot of you're the kind of doc I like to talk to who's got hands in a few different areas, and especially innovative areas. When we talk about the testing, where has the biggest hiccup been in the past? And how are you able to do this so efficiently?
Well, I would say the biggest hiccup is that when patients present for an infectious disease complaint, we're prescribing antibiotics too frequently. And as a consequence of that, we're seeing in the US and worldwide high rates of infections that don't respond to antibiotics. You have to only use antibiotics for a bacterial infection. And when clinicians try to make a good decision, they haven't always had the best test to give them a very specific view of what's going on with the patient. So we offer a type of testing called molecular testing. It looks at the RNA or DNA in the bug and specifically identifies what it is. Either it's normally part of their body, it's a pathogen, and also viruses and fungi or other. So with that very specific finding, you can give very targeted treatment. Sometimes an antibiotic is needed, but most of the time it's not. And that's the real add of what we do.
You just touched on what is one of those, whenever you get the question, what keeps you up at night? What keeps me up at night is antibiotic resistance. And believe it or not, that's not from a professional standpoint. That's from a personal standpoint, because I've spent so much time in hospitals and fought off antibiotic resistant infections. And so I'm very excited about this idea that we could be using less antibiotics and using them more efficiently, more targeted for the right reason at the right time. What took you into this area of medicine versus, say, surgery or psychiatry or the like? What brought you to this world of infection?
Well, I remember as a medical student thinking about my specialty, and I looked at anesthesia journals and general surgery journals. I like the family practice journals because they were very broad in subject matter. They often included pictures. There were both medical problems and minor surgical procedures. So I became a primary care doctor, and that's what I love. And I continue to do that. And I do it also in certain settings like urgent care. So that's my core medical specialty. I got into the health plan world and had an 18-year career there because I wanted to be helpful around population health, how to best spend the money to drive best experience and best outcomes. That was why I went in the health plan world. Then I had a chance to go to the lab industry, first to help them better manage their employee benefits, and then I learned about the lab space. And then that's been the career that I've been in for the past 9 years.
And you're based in Louisville?
Yep, Louisville, Kentucky. It took me
Excellent.
14 years to figure out how to pronounce it. It's actually just two syllables. Louisville. Yeah.
Louisville. Very good. Thank you for that. I'll remember that now for from now on. I've been to Louisville a couple of times and always enjoyed my time there. Can you tell me a little bit more about your work with University of Louisville in the it was a residence in innovation, was that right?
Well, when I finished up my time at Quest, which was a wonderful 7 year experience, I wasn't sure what I was going to do next. So U of L has this research and innovation center, and I signed up to be an entrepreneur in residence to help early stage scientists commercialize their ideas. And I did that for a little over a year until I joined HealthTrackRx. So I actually continue to work with a few companies that have been incubated out of the University of Louisville.
Are those and all of those companies are healthcare related, or do you go outside
They
of the
are
health
healthcare
space?
related. They are healthcare related. Some are in the area of health benefits. Others of them are involved in innovative types of laboratory testing. Some of them, frankly, are involved in hearing loss and creating a better experience for folks when they're evaluating a hearing loss experience. So there's a few different topics that I'm involved in.
Beautiful, beautiful. Can you tell me a little bit more about the hearing loss aspect?
Sure. Uh, People, as they age, often have a decline in their hearing, and you can get a very good measurement of how you're doing with a formal hearing test uh, that's done by an audiologist. But then the distance from that to decide, do I need hearing aids? And if so, which type, can be a hit and miss process. Oftentimes, the audiologists offer only certain types of hearing aids, and you won't have the opportunity to have a full spectrum of view of the units out there, the features out there. So this company that I work with has created an experience for folks where they can go in and have with headphones a certain audio visual experience that can help them select which hearing um, aids might be best for them. So that's pretty fascinating.
Yeah, because you've now touched upon my second biggest fear in life, which is losing my hearing.
Yeah, I can, given your journey, I can understand that fear. So
Yeah,
uh, what I would hope is that you've seen an audiologist and you've gotten an audiogram and you get those on schedule, and then you can have some communication about what your status is, and then changes usually happen slowly so they can help you prepare and then think about your options.
yeah, yeah. I feel pretty strongly and convinced that I need to take care of my hearing well, and so I do. I do.
Yeah, and that makes sense. And there are some things that you can do in the interim to protect yourself. Um, I have patients, some that have tinnitus. I have some patients that have hearing loss. We do certain preventive measures for them, including things like if they're traveling, put on earplugs when they're on a plane, and other things like that. And then and then follow things closely for them so that if they're having a transition, they don't have to be fearful and know that we've got a plan all ready to go when the time comes.
Good stuff. Good stuff. So I don't know if you've looked into my background at this part, but I've been teaching pre-meds at Notre Dame for the last 7 or 8 years now. And the beginning of the semester, I always, their first reflective writing assignment of the semester is to share a story about a time that someone was there for them or that they were there for another person. And I imagine with years and years of experience in the clinical world, you've had the experience of being there for other people. But does that question spark any stories in your mind about the time that you were there for
It
someone or
definitely
someone was
does.
there for
Yeah, it,
you?
it definitely does. I often receive gifts from patients that I don't expect are coming. And then I try to be helpful to select patients. And sometimes I do it quietly. And on occasion, a clinician will remind me of something they saw me do that they thought was very empathetic or showing compassion. So in the first case, I was in a very busy ER setting and we were seeing a lot of patients and an unusual high acuity, more seriously ill patients for this typical ER. So we were all running around and it was a bit exhausting. And as I was wrapping up my shift, I interacted with a patient who was remarkably kind and remarkably patient and seemed to have a very modest need, something such as it was the end of the week and they hadn't got a medication filled. And it was my pleasure to take care of that. And she made an observation that the ER was a bit busy for this day. And I acknowledged that. And she just conveyed her appreciation for the team. And it was only after talking with her a bit that I learned that she was managing stage 4 breast cancer and had some young children. So you can imagine what's on her mind on a daily basis. Yet she had the energy to give a gift of me about compassion to me. I've not forgotten that.
Mm-hmm.
And then a story that a nurse that I had when I was practicing in upstate New York reminded me is that a patient came into our clinic about the third visit that he presented. And he was someone that was disheveled in clothing, had some dirt on his clothing, frankly, had an unpleasant smell around him. And he was here for a third visit because he hadn't gotten an answer to his problem. And what I was able to do was listen to him, examine him, and be patient with him and accepting of him. And ultimately, what we identified is that he had a certain gastrointestinal cancer, and then we got him the care that he needed. And my nurse at the time was complimentary that I didn't think about the distracting elements and just interviewed him and examined him clinically and got him on the right care. I'll share with you a technique that I use when someone comes in
Please.
and they might have a bit challenging physical presence or other issues. I imagine that they're the local bank president. And I say in my mind's eye, the local bank president is coming to us clinically. If you set that expectation when you're about to evaluate the patient, it changes everything and you're inclined to do a really good job.
That's a great technique. Yeah, yeah. Bring it back to professionalism. And I love what you said too. The first thing you said about treating the patient who was disheveled is you said, I listened to him. I listened to him. And whenever I go into the narrative medicine background, I really try to break down everything into kind of a 2 word summation, which is active listening. How can we best hear what our patients are saying, and even more importantly, maybe what they're not saying? That then we get to ask those questions that go further and give us a better picture of their overall health. So I love what you said about just listening, starting with listening.
Yeah,
Not rocket science, right?
well, I agree with you. I mean, wasn't it Voltaire who advised something to the effect that a clinician should sit by the patient and listen, and they will tell you what ails them?
Mhm.
So I agree. Uh, that is a starting point to build trust, to build receptivity, to create a safe environment. I think those are all critical elements.
Yeah, yeah. So I wanted to ask you about the organizations that you're a part of. Is there an online presence where people could learn more about them or about you, for that matter, and your work?
Absolutely. Our company is HealthTrackRx. So if you look up healthtrackrx.com, you'll learn about us and what we do. And then me personally, I have a LinkedIn page and that describes my professional activities. I share what I'm doing, uh, whether a talk or a post or something I'm reading, and then welcome people to share what they're thinking about. I'm glad to exchange.
Hmm. LinkedIn is such a valuable resource for the professional who is always looking to expand their knowledge base.
Absolutely, absolutely. I recently gave a talk uh, on urgent care and dyspnea, what happens when someone presents with shortness of breath. And it was a good exercise to go through for an audience of clinicians. That said, I learned some good things that will help me with my next shift.
Good stuff. Good stuff. Well, Dr. Goldberg, thank you so much for being with me today. And I guess I want to end on one last question for you. Is you've got your hands in a lot of different things, and I know that you keep your eye on the horizon of what's coming. So, what in medicine or healthcare these days leaves you feeling hopeful and excited?
I would say, Marcus, movement in the topic of personalized medicine, where people's genes can inform insights about present and future health status and use that information to get on things earlier. I'm very excited about that. So that's something I'm involved in a bit. Um, and then what keeps me concerned is the cost of healthcare, especially for modest income individuals and folks who are of low income, given some policy changes that are coming forward. It's going to make things more difficult for them. And that is concerning to me.
As if it wasn't already hard enough to be poor in America, right?
Uh, we just want to, at minimum, want people to have access to high quality care and prompt care and empathetic care and care that doesn't put them at risk for bankruptcy. That's a minimum goal I would see for us.
It's a great goal. It's a great goal. And this has been a great conversation, Dr. Goldberg. Thank you so much for being
Thank you,
with me and
Marcus. I'm
sharing your
inspired.
expertise.
Marcus, I'm inspired by you and the contribution you continue to make every day. And it's something that I will carry me with me to my shift this afternoon. So thank you for doing what you're doing.
Thank you so much. And if I can do anything for you or the companies or the ventures that you're in, please reach out. I'd love to help out however I can.
Thank you.
Awesome. And listeners, thank you for being with us on this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and please visit marcusengel.com for your keynote speaking needs, books, compassion consulting, etc., etc. And we will see you all next time on Compassion and Courage.